Hi there, health warriors! Welcome back to the channel of Earthluxe, your trusted space where ancient wisdom meets modern healing. Today, we're bringing light to something that most people only whisper about, if they talk about it at all. You know that strange pressure, that itch you pretend isn't there, or the discomfort that seems to come out of nowhere. Maybe you chalked it up to sitting too long or blamed it on last night's spicy dinner. But what if your body is sending you a signal? One you've been too embarrassed to decode. The truth is, hemorrhoids are incredibly common, affecting nearly 3 out of 4 people at some point in life. But despite how common they are, no one really prepares you for how disruptive, and yes, how distressing, they can be. In today's video, we're unpacking what hemorrhoids actually are, what causes them, and most importantly, how you can prevent them naturally, mindfully, and confidently. Because when it comes to your health, there's no room for shame. Only understanding, compassion, and empowerment. So stay tuned. What you'll learn today might just help you sit and live a whole lot better. What are hemorrhoids really? Let's clear the air, because what you've heard about hemorrhoids might not be the full story. Contrary to popular belief, hemorrhoids aren't some random condition that suddenly appears out of nowhere. In fact, you were born with them. Hemorrhoids are actually part of your body's natural design. Soft, cushion-like clusters of blood vessels and connective tissue located in your rectum and anus. Their job? To help maintain control during bowel movements and to create a seal that keeps things where they're supposed to be. They're like the unsung heroes of your lower digestive system. But problems arise when those helpful cushions become swollen or inflamed, usually due to increased pressure. And that's when things take a turn. You might feel itching, burning, or even sharp pain. You might notice blood on the toilet paper. And suddenly, everyday things, like sitting through a meeting or going for a walk, start to feel like a challenge. There are 2 main types to know. Internal hemorrhoids. These stay inside the rectum. You often won't feel them, but they can cause bright red bleeding during bowel movements. External hemorrhoids. These form under the skin around the anus. They're the ones you can feel, often painful, tender, and hard to ignore. So no, hemorrhoids aren't some shameful condition. They're part of you, but when they act up, your body's asking for attention. And that's where knowledge becomes power. What causes hemorrhoids? It's tempting to blame your office chair or a long flight, but the root cause goes beyond just sitting. Hemorrhoids begin when there's too much pressure on the veins in your lower rectum. And that pressure? It builds up in ways we often overlook. Think of those bathroom breaks that stretch a little too long, scrolling, straining, waiting. It may seem harmless, but that tension adds up. Then there's the gut. When it's off balance, and constipation or frequent trips to the toilet become part of your routine, your body pushes harder than it should. Pregnancy plays a role too, as the weight of a growing baby and shifting hormones naturally strain the body. Even lifting something heavy without proper form can send a surge of pressure downward. And yes, sitting too long, especially without breaks, makes things worse. With age, the tissues that support those veins begin to weaken. It's not just one thing. It's the quiet accumulation of everyday habits. And once you see it, you can start to shift it. Symptoms you shouldn't ignore. The tricky thing about hemorrhoids is that they can live in the background, quiet, unnoticed, and easily brushed off. But when they make themselves known, they rarely do it subtly. It might begin with a persistent itch or a strange irritation that won't go away. Then there's the surprise of bright red blood on the toilet paper or in the bowl. Alarming, even if painless. Sitting may start to feel uncomfortable, and bowel movements might come with a sharp sting or ache. Sometimes you might feel a tender lump near the anus, something you hadn't noticed before. And in more severe cases, there may even be some leakage. An unwelcome symptom that can be both confusing and distressing. If any of this sounds familiar, you're not alone. And there's no reason to feel embarrassed. These signs are your body's way of saying, something needs care. One important reminder: blood in the stool isn't always from hemorrhoids, so don't guess. Talk to a healthcare professional and get it checked. Because your peace of mind is just as important as your physical health. How to avoid hemorrhoids? Let's talk about the good news, because yes, there's actually a lot you can do. Hemorrhoids might be common, but they're not inevitable. With a few mindful habits, you can reduce your risk and keep things moving comfortably. It all starts with softness. And no, not just in your toilet paper, in your stool. That means fiber-rich foods, fruits, veggies, whole grains. Fiber keeps things soft and regular. But fiber alone isn't enough. Your body needs water to move things along. No hydration, no movement, and that leads straight to straining and pain. Next up, timing. When your body says it's time to go, go. Don't wait. Holding it in can lead to dry, difficult bowel movements. But don't camp out on the toilet either. Scrolling through your feed for 20 minutes may be relaxing, but your veins won't thank you for it. Movement is medicine. A simple 30-minute walk each day helps keep your digestive system active and balanced. Sitting all day slows things down, and your gut feels it. And finally, be smart about how you sit. If you work at a desk or drive a lot, take breaks. Use a cushion when needed. Even how you sit on the toilet matters. Consider using a footstool to help your body align in a more natural, effective way. And if you're lifting heavy at the gym, breathe properly and lift with care. No heroics needed. Bonus tip. For relief when symptoms do appear, try witch hazel, warm baths, or over-the-counter creams. But if the issue lingers, don't suffer in silence. There are modern painless treatments available, and getting help is a sign of strength, not weakness. Having hemorrhoids doesn't mean something's wrong with you. It means your body is asking for a little more care, a little more attention, maybe in ways no one ever taught you to give. And you're not alone in that. From long-distance runners, to exhausted parents, to people who seem to have it all together. This is more common than you think. It's just that no one talks about it. Until now. So if you felt the itch, the pressure, the discomfort, you're not weird. You're human. And the next time it shows up, you'll know exactly what to do. Because now you've got the insight, you've got the tools, and most importantly, you've got permission to take your health seriously, even in the places no one wants to mention. If this video helped you feel a little more seen, a little more equipped, give it a like, share it with someone who needs to hear it, and subscribe to Earthluxe for more grounded, real conversations about healing and health that actually matter. Until next time, be gentle with yourself. Trust what your body is telling you. And remember, you deserve to feel good, all the way down to your seat.